Yes, Ebola is a fearsome disease. This is a pathogen unlike anything that we've ever seen before. But I know the power of ozone and oxidative therapies. I know it. I wouldn't be doing this if I didn't have absolute confidence that we're going to dramatically cut the death rate.
You need some type of weapon to fight these outrageous potential epidemics that might impair us.
My own belief is we will slash the death rate in these people. That's what I expect to see, or I wouldn't be doing it. And if we do that, we're going to give a lot of hope to the world.
Ebola has been in the news, creating lots of fear and concern. So what is the real truth? Hi, this is Dr. Mercola, and today I'm joined by Dr. Robert Rowen, who has been with us many times before, and he's going to help us expand on that answer. And he has actually been invited by the president of Sierra Leone to go to that country, and he's leaving very shortly as we're doing this interview, to use oxidative therapies to treat Ebola, and we're going to go into that in more detail. So welcome, and thank you for joining us today.
Thank you, Dr. Mercola. It's a real pleasure to be with you again.
Can you give us a little backstory to get people up to date on what the current process is?
Well, your viewers know that I do oxidative medicine. I do ozone, ultraviolet blood irradiation therapy, high-dose vitamin C. All of these collectively belong to a family of therapies called oxidative therapies. And in my opinion, and I've been doing them longer than any other living person in North America since 1986, in my opinion, especially ozone and ultraviolet are among the most powerful therapies for healing across the board of anything I've ever seen in my career. They can do more to help more conditions, especially ozone, than anything else. And why ozone? Because it's much more versatile. You can give it any number of ways. And your viewers, some of them may have gone to my YouTube channel, Robert Rowen, MD, all one word, ROBERT, ROWEN, MD channel, to see what these therapies can do. Right now we're faced with probably one of the most horrific epidemics humankind has ever known, and that's with a virus called Ebola, that is transmitted by personal contact, bodily fluids, and actually it may be airborne. There is some evidence that it could be transmitted airborne. What I don't know, and I'm trying to investigate, is how easy it is transmitted person to person. I'm not sure that it's that easy to get, because if it was, everybody should be dead by now in many of the villages, and not everybody is dead. Then on the other hand, we know that there are aid workers who have gotten the disease and died even wearing full suits. Maybe they made a mistake with their gloves or something. So this is really a terrifying situation. And anybody who works with Ebola is putting their lives on the line, because there are no conventional therapies for this. None, except supportive care, like giving IV fluids, giving oxygen, maybe giving heparin if they're clotting too much, but otherwise there's nothing for it. And I got the notion a couple months ago, heck, why not do ozone? So I contacted the embassy of Sierra Leone, and they didn't show much interest. That was July. In fact, they wrote me back or called me back and said, we think the epidemic's under control, and 3 days later, doctors are dropping like flies. And through a series of events, I actually got put in contact with a key physician in Sierra Leone, and then to the office of the president of Sierra Leone, and they are extraordinarily interested in ozone therapy because it is a novel treatment that has virtually no toxicity. In fact, we don't know of any toxicity for ozone, although who knows what's going to happen with somebody infected with this virus. That is extraordinarily anti-infective. That's number one. And I say extraordinarily because its mechanism of action on bacteria is literally to punch a hole in the membrane of the bacteria, and the bacteria spills its guts out. It's like being shot with a bullet, and it hemorrhages. With viruses, ozone can inactivate the virus, and it can inactivate the virus 10 times faster than chlorine. And chlorine is being used overseas right now For Ebola, to disinfect clothes, their isolation suits, etc. But ozone disinfects 10 times faster. It's the most powerful natural oxidant in the world. Ozone also has the advantage of stimulating the immune system, modulating it. And Ebola, actually, if you look online, they're saying that Ebola itself might not kill you. It's your own immune system, because Ebola hijacks it, suppresses it, and then when your immune system finally realizes it's there, it comes out with something called a cytokine storm. And that cytokine storm leads to massive tissue destruction and leakage of your capillaries. So that's why you get hemorrhage. So ozone modulates a cytokine storm. It's anti-infective. It improves circulation. It improves the rheologic properties of blood. That means blood flow. You're going to get better blood flow, and it improves oxygen delivery. And finally, it probably, when I say probably, we actually haven't measured the mitochondria, but indirectly we have, it upregulates mitochondrial respiration, generating more energy in the cells, and that's what you need. And when you have an infection, and in fact, any healing process, the most important thing you need is oxygen to get to the tissues to make energy to heal and to quell inflammation. And I see that every day when I treat a knee with arthritis. Shooting ozone into it, even once sometimes, gives such a dramatic effect the patient doesn't come back, because it stimulates healing within the joint and quells the inflammation that's causing the pain and destruction.
Well, thanks for the excellent summary. And just wanted to give my perspective on it, because it does appear that there is a drug, although I'm not sure that's the best term for it, but there's a treatment which is basically a passive antibody that's been developed, and it's called ZMapp, essentially extracted from mice and then grown in tobacco plants, and very costly to produce. And it's not commercially available at all. It's a very low scale, but it seems to work early on because it works with the body's immune system. It just kind of slows down the increase in the viral load, so the body has enough time to respond and not get killed by the cytokine storm. So it sounds like the ozone therapy has two methods of treatment. One is it's directly toxic to the virus, and then also it enhances the immune system. So maybe you can expand on that and how it compares to ZMapp.
Well, I don't know much about ZMapp. I'll say that it's going to be extraordinarily expensive. I think everybody knows that. It might be produced in limited quantities, and it works indirectly. Ozone works both directly and indirectly. It kills virus, period, end of story. It kills bacteria, end of story. And somebody's going to say, well, why doesn't it kill our own cells? Ozone is only hard on the lungs. It can be given any other way. It can be given intravenously. It can be given in the bladder, in the vagina, in the rectum, by injection, anywhere. It's just it can be tough on the lungs. So you don't want to be breathing it. I don't want your group to be led astray on that issue.
Sure.
Also, the way ozone can be done is dirt cheap. And in a place like Africa, where there's thousands of people with this and there's just no money, can you imagine what it will mean to the planet if we can treat this disease with a therapy that will cost probably less than $10 per patient? Now, compare that to the antibody you were talking about.
Yeah, and that antibody, aside from being extraordinarily expensive, has to be given in a very narrow window. The first patient to die of Ebola within the United States died 2 days ago, as we're filming this, we're recording this rather, and he was actually given ZMapp, but he was given it like 2 weeks or 18 days after the infection, and you have to give it, it didn't work, died. So you got to get it early enough, and ozone likely could have rescued him. There's some other questions, is that they may have given him antibiotics, like fluoroquinolones, which actually also sort of decimate his infection, his immune system, because they're not going to help treat a virus.
Exactly. It appears from what I could read that when he was turned away initially, he was given an antibiotic. And, that's so sad, because that's American medicine. Go to the emergency room or go to the doctor, have a fever, you don't feel well, here, take this antibiotic and go home. But the majority of what we're treating are viruses. An antibiotic, if it does anything, it's going to hurt you.
Yeah, and it does that through damaging one of the most potent components of the immune system, which is the gut flora. I mean,
Exactly.
How could you decimate your gut flora and ever hope to recover from this type of viral infection? I mean, if you ever looked at it carefully, there's no other rational response than say, what the heck are they doing?
I'm in full agreement with you.
So maybe you can expand and give us what you hope to accomplish in Sierra Leone and the time frame, because you're leaving in a few days, aren't you?
We're leaving a week from yesterday, and we should be in Sierra Leone a week from tonight, and probably maybe even getting to work on Saturday morning. This is what I'm told by the physician, that the government has set up an Ebola center that's separate from the international relief centers. And this is going to be our center to work. And my plan, I'm a clinician, remember that. I'm not a scientist, and I'm going to have to get some science now, because my plan is to divide the Ebola patients that are seen, and for the viewer, I want you to know, I'm not planning on treating the Ebola patients myself. So yes, there is danger going there, and there's concern. But our goal is to train their local health professionals to do the treatment, which we will oversee. So no doubt I will have to walk into an Ebola treatment facility fully suited up, but I don't plan to lay hands on the patient. That's going to be done by someone else.
Well, worst case scenario, if you did get infected, you've got the treatment.
I intend to do the treatment on myself and my team every single day, without question, from the day of arrival to many days after I leave. So this is not a worst case scenario, it's routine. And I will do this on myself, and we'll be sure all of us are treated. I have less fear about Ebola with this, and I mean this, and I'm speaking honestly. Yes, Ebola is a fearsome disease, but I know the power of ozone and oxidative therapies. I know it. I've lived it since 1986. So I wouldn't be doing this if I didn't have absolute confidence that we're going to dramatically cut the death rate. We'll never 100% cure anything. That's out of the question. My own belief is that if we divide them up into three groups, Group A, B, and C, A is early, as soon as they start getting symptoms. Group B is moderately advanced, and Group C is pretty bad. And maybe hopefully we'll get to do a few Group D near death. I mean, just prior to death, because they need to I just don't want to let them die. But let's talk about Group A. You've got a fever, you're feeling bad, you got a headache, you got some nausea, and we know you have Ebola because your test is positive. My own belief is we will slash the death rate in these people. That's what I expect to see, or I wouldn't be doing it. And if we do that, we're going to give a lot of hope to the world. And why do I say that? Because if you look at ultraviolet blood irradiation therapy, Ozone's sister therapy, in the American Journal of Surgery in 1947, this is a key prestigious journal, it detailed 445 consecutive cases of acute pyogenic infections. Pyogenic means bacterial infections at the Hahnemann Hospital in Philadelphia, of which, now let me correct myself, about 225 of the 450 cases were consecutive cases. There's your double-blind controlled study. It's approving. It's consecutive cases. These are people with bacterial infections who otherwise couldn't be treated. This was when antibiotics were in their infancy. Of those they caught in the early stages, they had virtually a 100% cure with ultraviolet therapy. Where did this go? We can't even do that today, especially with things like MRSA. If it was moderately advanced, they had a 98% cure. And if you were unconscious, moribund, on death's door, it had about a 50% cure rate. The doctors took pains to describe this in their writings because they couldn't believe what they were seeing. Patients with septic cerebellar infarcts, that's an infected blood clot to the brain, walking out of the hospital after a couple months. Fevers breaking from sepsis, that's bacteria in your blood. Fevers breaking in 24 to 48 hours. Viral pneumonias clearing in 72 hours. Viral pneumonias, let's get back to that. Oxidation therapy was actually born during the great influenza outbreak of 1918, that had more to do with ending the First World War than the war itself. People were dying like flies across the world. A physician in India, when India was British, named Oliver, was treating viral influenza, which has no treatment even today. And if there was an avian flu outbreak, that's how it would devastate the population. Airborne transmission, human to human, getting in your lungs and filling up your lungs with fluid. That's what he was treating. And that flu was basically an avian flu. I think it's like H5N1 strain. When he gave intravenous hydrogen peroxide, which cost a couple cents to do for materials, he cut the death rate by 50%. I'll be presenting this when I go to Sierra Leone. And his comment at the end of his article, published in Lancet, major medical journal, is, "This is more remarkable because we only treated the worst cases." Dr. Mercola, I believe that there is a place for drugs. Don't get me wrong. But I believe they're misused and abused 90% of the time. Clearly, lives have been saved with antibiotics. On the other hand, I'm going to tell you, and if you go to my YouTube channel, you'll see a woman with MRSA who was at the end of her rope. She was on the last possible drug she could take by mouth for her MRSA.
Let me just interject. For those who don't know, MRSA is methicillin-resistant Staph aureus, a very deadly infection which is resistant to most antibiotics.
Thank you. And she was quite scared. She was at the end, the last drug that she could take, and she was still getting outbreaks of MRSA. And she came in, and we gave her one session. She came back 2 weeks later, or a month later, and said she couldn't believe it. It was basically gone. I gave her one more treatment, and I didn't have to see her back. I had somebody who was working in our office who had cellulitis from a tick bite. Now, that's not Lyme. Let me explain. Lyme is a chronic infection. It comes on over time. This woman had cellulitis, and I hope you can see it. She had a tick bite here, and then within a day or two, a terrible rash down her arm to here. And she was in a lot of pain and sick. I said, well, why don't you come over? I'll treat you immediately. And she said, no, I'll wait till we get to the office. I mean, suit yourself. She waited another day, and it was worse. We gave her treatment. And in her case, I wanted to give her ultraviolet blood irradiation because it was likely a bacterial infection. And she wanted to work immediately, so she said, well, no, let's do ozone because you can do it faster, like 15 minutes. So we did it. By the end of the day, this is unbelievable. By the end of the day, the rash had regressed from here to here. That's 4 hours later. And by the next morning when I saw her, the only thing that was left of this purple-blue rash was the rash was totally gone. The only thing that was left was a tiny little crater right here where the tick had bitten her. There was no discoloration, nothing else. It was gone, a single treatment.
Wow. And how was the treatment administered? Was it intrarectal or IV?
In her case, it was IV.
Okay.
And if you're going after something that's hot, I believe it should be given IV. If you're going after something that's chronic, long-term, maybe like Lyme, although I think you'd be better off with IV for Lyme. In fact, I know you would because I treat it. But for something more chronic, rectal does work, and it works just fine, and the Cubans have shown that. In fact, I was in Cuba just a few weeks ago, legally, because there was a seminar that was put on, and I listened to some world-renowned researchers in Cuba, and there was a group, and I spoke there as well on what I do.
Yeah, and actually my dentist, Dr. Lena Garcia, was at that conference with you. And interestingly, after she came back, I was I was in Chicago, and on my trip, I just had some exacerbation of a tooth problem. I thought I was going to have another tooth pulled. I mean, it was really painful. I went in there, she treated me every day for 5 days with ozone, and guess what? It was gone. It was gone. So I am a believer, and in fact, I'm going to get one of those machines. The new Enlay machine is an alternative to the Longevity. I'm in the process of ordering it right now.
Oh, good. You'll have to let me know about it.
Yeah. It's a lot less expensive, and it's portable, and it's really seems to work great. So, yeah, I am a believer.
One comment.
Staunch believer now.
I'm glad you're a staunch believer. I've been using this since 1986, and it is the most incredible healing method we've ever seen, and it does so by stimulating your own body to heal. By the way, if you're going to get a machine, please be sure that you're not dealing with a machine that has Chinese components.
Okay.
If they have Chinese components, I don't think you're going to be happy in the long run.
Okay, what's the concern there?
They'll deteriorate.
Oh, because the ozone. And actually, you had mentioned, I meant to bring this up. You had mentioned that the ozone was 10 times more potent than chlorine. And many people may not realize that the reason chlorine works, it's an oxidizing agent. That's how it works. Exactly. Chlorine is an oxidizer. And so is ozone, but 10 times more effective. So my guess is that with the Chinese parts, it's oxidizing the internal components.
Exactly. And that's why I'm very careful. And when somebody asks me where I recommend a machine, I feel comfortable that the Longevity machine, which can be easily obtained for water purification purposes, is a rock solid machine, and they stand by it. I've had a couple technical problems with it, like a switch, and they have fixed it instantly on the spot, on the house.
Okay, good. Well, if you're a clinician, I couldn't recommend and endorse it more heartily. It's absolutely, and if I was practicing now, it would be guaranteed in my office. Because it's such an effective modality. I mean, it's just crazy now too. There's virtually no toxicity unless you breathe it, but that's pretty easy to avoid. And the potential is enormous, especially for these potentially devastating disease epidemics, like where there is no other option except to rely on your immune system. Which is some pretty good strategies. Stay away from sugar, get vitamin D, eat healthy foods, and you got a pretty potent immune system, and likely you'll beat it. But why take the chance when you've got something that can accelerate the process?
Dr. Mercola, I've told my patients, and many of them come from out of town, lots of them do, and I've told my readers through journalism and in my lectures, please know where your closest oxidative physician is, because your life might depend on it, and now we know that could happen with Ebola reaching our shores. And I want to emphasize that again to your broad audience. Please know where your closest oxidative physician is. And if you had the wherewithal to get a machine to purify water, it could be easily adapted in the privacy of your home so that you could administer it rectally for whatever condition you have. By the way, it's terrific for heart disease. The Cubans have shown that. The Europeans have shown that if they have heart or circulation disease, if your immune system is weak, if you just want to get better oxygen delivery, and oxygen is the stuff of life, the more oxygen you consume, the longer you're going to live and the healthier you're going to live. Other aspects about ozone that people don't know.
Let's stop there, because that's an important point before we go on. Anything in excess can be a problem. You really want the Goldilocks approach. And my understanding, and certainly I want your feedback on this, is that ozone, too much oxygen can be dangerous, and there's a whole theory of aging that goes into excessive oxidation that can accelerate aging. But my understanding of ozone therapy is that it's somewhat similar to exercise, where you give it to the body, you get this oxidative stress, and it builds up your own internal antioxidant systems, maybe even superior to any oral antioxidants that you can take. So what's your take on that?
Spot on. If you want to, and I've got the research that shows that, spot on. If you want to build up muscles, you do this. You pump iron. Now, that does break down your muscle temporarily, and you feel sore. But you come back a day or two later much stronger, and your muscles are stronger. Ozone does the same thing. And a key enzyme, which you and everyone has probably heard about, is SOD, superoxide dismutase. It's one of the key premier enzymes in the body. And when you use ozone therapy, study after study shows that SOD activity goes up. So you're actually getting, paradoxically, you're using an oxidant, yet getting a much more powerful antioxidant system in your body to deal with damage. And SOD has one other really cool thing. It stimulates telomerase. And, telomerase is, for your viewer, telomerase is the enzyme that maintains the telomere at the end of the DNA strand and keeps your DNA more youthful.
Yeah, because there's other theories of aging that the end cap telomeres, that as you age, those tend to decrease, and then once you reach this critical threshold, you're dead. So it would be good to do that. But then there's other people who say that increasing the telomerase actually increases your risk of cancer too. So there's like everything. There's a balance.
Yes.
Yeah. But anyway, it probably, when you're working with natural approaches like ozone, the most likely it's in their self-regulatory systems, you're more likely not to overdo it, as opposed to forcing large loads of antioxidants or whatever. That there's unintended consequences typically.
Ozone stimulates the body, and the body in its own wisdom knows the set point. So if your body's like this, what ozone seems to do is bring you like this, and if it's like this, it brings you back for balance. Ozone seems to do that. If you take a pharma drug or you take some type of chemical, if you're like this, it might bring you into balance by bringing you down here instead of bringing you up like this. Ozone modulates. For example, nitric oxide is another good one. You need enough nitric oxide so that you have circulation. It's a vasodilator. Or you have erectile function. But if you have, and you also need nitric oxide for your immune system to kill pathogens. It's actually, it participates in killing pathogens. But if you have too much nitric oxide, it's toxic. And it can damage your neurons by creating even a worse free radical called peroxynitrate. And ozone modulates nitric oxide production so that if you don't have enough, it brings it up. If you have too much, it brings it down. It is the most, for lack of a better term, it's the coolest, most swift treatment I've ever seen in my life.
Yeah, it's because some people, to improve their nitric oxide, will take arginine, which increases it. But if you take too much, then you get this peroxynitrate issue. So you really love these self-regulating therapies. Now you're still a practicing physician. You see patients regularly, and you have access to essentially every modality, more so than almost any other physician I know. That would include hydrogen peroxide, IV vitamin C, as you mentioned earlier, the ultraviolet blood irradiation, and ozone, of course. So I'm wondering if you could put that in a perspective, in a frame. And my guess is, from everything you're saying, if you could only have one, you'd probably pick ozone.
Yes. No doubt about it.
That's a pretty powerful statement coming from someone who's had a chance to use them all, not only use them, but to use them and see the results and the impact. So maybe you can expand on that and put everything in a frame for us.
Okay. There's many diseases. There's immune diseases, there's trauma, there's chronic degenerative disease. Suppose you have a therapy where somebody walks into your office with degenerative osteoarthritis and they can barely get in the door. They're in so much pain, they're holding onto the wall, stumbling all over the place in agony, and you see sheer pain on their face. And 30 seconds later, they get off of the table with a smile ear to ear, going, oh my God, oh my God. That's one of the videos that's on my YouTube channel. It's called Oh My God, Knee Pain Relief. And it lasts. Yes, literally, oh my God, knee pain relief. If you see that, it just changes your life. You saw it before and after. I'm now videoing them before I treat them and then right afterwards, even before they get off the table, so you can see it instantly. So just imagine if we could knock out 80% of knee replacements in this country, because I've found and my colleagues have found that ozone is about 85% effective in knees, a little less effective in hips. It's a little more technical injection, but we're getting good results there too. Now that's just us.
How does that treatment work? That is, because the knee replacement surgery, last time I looked, which was a New England Journal study that did a double-blind, placebo-controlled, randomized, multi-center trial, found it wasn't any different than a placebo. And it was, at that time, $3 billion. It's probably $5 billion a year industry now. So how do you actually inject it within the knee joint itself? Do you give it intravenously, rectally? How does it work? Or can it work rectally?
Probably no. Here you need it local. And I'm going to explain what the Cubans did. I mean, of all places, Cuba. Why not? Why is this being done there? Why not here? I mean...
Federal regulatory authorities would be my guess.
You follow the money trail. Cuba needs a cheap, effective treatment. But in our country, it's based on chemicals that don't cure. I mean, if pharma came out with something that actually cured you, they'd go out of business next week. And let's go to arthritis, because that's a big problem for people. Mm-hmm. Europeans are using ozone therapy in the back for discs, and you don't even have to get the ozone to the disc. You can go down to the facet joint like with common prolotherapy, or you can even shoot the ozone in the paraspinous muscles. It doesn't have to be right there because it seems to migrate. Now, because
it's a gas.
It's a gas.
Right.
And it can migrate. I'll give you 2 examples to help you understand. Let's get back to that lady with the knee. Mm-hmm. She stumbles into the office. She's in horrible pain. And I hope your viewers will go to my YouTube channel and see that one. It's been viewed more than any of the other videos. She gets off the table and she's just going, oh my God. She's laughing. She goes, yeah. I say, yeah, what? Yeah. I have no pain. Now, it's true that we put a local anesthetic before we put the ozone in, because the ozone can sting for about 60 seconds, and then the stinging goes away. So yes, there's a local anesthetic, but how do you explain the fact that the very short-acting local anesthetic I use 1% preservative-free Procaine, very short-acting, the pain doesn't come back, or it comes back much, much less in a large number of patients? Any idea how you can explain that?
No, I can't. Other than it's the ozone's working.
Yes, and it's because it's the ozone that's working. And here's what the Cubans found. And I have a slide, and it's now part of my presentations. The joint doesn't have a good circulation. In fact, it has no circulation. All of the nutrients for your knee, for your cartilage, comes from the synovial membrane, which is outside the joint. It has to diffuse in passively. So the bottom line, once again, is oxygen, getting oxygen to that joint. Now, I'm actually injecting oxygen. 1% of it is O3, 99% of it is O2. So they're getting a blast of oxygen, and they're getting ozone. So there's 2 effects. One, they're getting oxygen, the most important thing those cells need to heal. And they're getting ozone, and ozone instantly modulates the inflammation. It knocks out the excessive nitric oxide that's in the joint. It increases other chemical mediators that reduce inflammation. Remember, I said it modulates, it decreases TNF alpha, tumor necrosis factor alpha, a really seriously bad cytokine when it's there where it shouldn't be. You need it if you have cancer, but if it's too much in good tissues, it's going to cause terrific inflammation. So the local anesthetic goes away in 10 minutes, but the pain doesn't come back, or it comes back much less attenuated, because that oxygen and ozone is going to work instantly to reduce the inflammation. Bang, just like that.
Oh, well, thank you for that explanation. And because we got on a tangent, I forgot a really important question earlier. You gave the encouragement, which I absolutely strongly endorse and support, that everyone needs to know where their nearest oxidative physician is. So how does someone find an oxidative physician?
There are several sites that can. On my own very small website, docrowen.com, I've listed doctors that I personally trained who are interested, who are open to being posted. So if you want somebody who's been trained by me personally, you can go there. OxygenHealingTherapies.com is another one that has a broader list of doctors who might not do the broad expanse of therapies that I do. ACAM, American College for Advancement in Medicine, has a listing of doctors, and many doctors who do oxidation will stay on their posting that they do oxidation therapies. That's probably the best I can tell you. There's also the American Academy of Ozonotherapy, and they may have a listing as well.
Okay. And of all the oxidative therapies, because there are many, you believe ozone's the best?
Ozone, I believe, is the best because it's the most versatile. There are some people who are doing ultraviolet blood irradiation therapy alone for blood treatments, for infection, for chronic fatigue. It's terrific, but it doesn't have the versatility because you're not going to put blood into your joints for
Absolutely.
this.
So you never really finished answering the question about the comparison between the hydrogen peroxide IVC, the UVB.
And I was just going there.
Okay, correct. I'm sorry. I interrupted you, probably.
That was my next.
Okay.
I've done intravenous hydrogen peroxide since 1989, maybe 91. I don't do much of it. It works. It's another oxidation therapy, and it's dirt cheap to do. But one of the reasons why I don't like to do it is because it's hard on veins. It actually can make your veins here disappear. They go away. I saw that in Alaska a lot, and my friends said, well, it's a cold climate, and maybe the veins are small to begin with, but I've seen it here too, and ozone doesn't do that, at least the way we do it with major autohemotherapy. We've seen no vein problems, zip. Of course, if you stick a needle in the vein, there's local trauma to the vein, and if you stick it enough, you're going to damage the vein from that. That's one, intravenous hydrogen peroxide. It works hard on veins. There's ultraviolet blood irradiation therapy. Fantastic. Not quite as versatile as ozone. I have gone back and forth on my patients between ultraviolet blood irradiation therapy and ozone if they have Lyme disease, chronic fatigue, etc. Some of my patients like ozone better. Some of them like the ultraviolet better. And by the way, I wrote an article that's on my docrowen.com site. It's called Ultraviolet Blood Irradiation Therapy, the Cure That Time Forgot. It was published a long time ago, and I summarized volumes of American literature on this. This was done widespread in this country till the 60s. And then when you could take a pill, it was wiped out. And there's political reasons why it was wiped out too, and I know that for sure. But it's still being done. Then there is high-dose intravenous vitamin C. And you're going to say, well, wait a minute. Vitamin C is an antioxidant. Well, it is and it isn't. The National Institutes of Health picked this up by a fellow named Mark Levine, who's a researcher there. And he wanted to look into, well, what are they saying about vitamin C? And he found with really elegant research published that when you give high-dose vitamin C intravenously, the ascorbic acid leaves the bloodstream and goes into the interstitial fluids where a series of reactions occur that incite a greater production of superoxide, which gets converted by the body into hydrogen peroxide. So when you give intravenous vitamin C, you are actually giving hydrogen peroxide, and it might be a more effective means of getting hydrogen peroxide into the cancer cells.
Excellent. So but still, the ozone is a superior approach, and the C can be hard on your veins too. I mean, you have to 25, 50 grams, and it takes 3 or 4 hours or longer, to administer. It's not a quick treatment.
Exactly, and that is one reason why I have shied away from it. Yes, my colleagues are using it for cancer. There have been a few who say it's terrific, but I've talked to a lot of them who say they're not happy with it for cancer. The jury's out. I think, just like everything, in some hands, certain things work great, which don't work in other people's hands, and I see that repeatedly with vitamin C. I've had some results, and it's posted on my YouTube channel. Swami A recovers from terminal colon cancer. Now, this is something that is almost unbelievable if you see this video and you saw the pictures of him when he came into the office. This man was on death's door when he came to the office. He was given up for dead, probably a few weeks to live. His alkaline phosphatase was around 600, 5 or 600, which is a liver enzyme indicating severe damage. He was emaciated, and his followers begged us to take him. We started doing ozone therapy on him twice a week, amongst other oral treatments, and he followed my dietary program. He followed doing supplements. I saw him in January of 2010. By May of 2010, the man was back at work part-time. A year and a half later, all that was left was a primary in his cecum. The liver metastases were gone, literally gone. And when I got that report, I called him up and I said, "Hey, Swami, look, I'm an integrative physician. I believe in orthodox medicine when it's necessary. You still have the primary. I know you don't believe it, but you do because you're bleeding from it. Go get it taken out." So he went and he had it taken out. This was in 2011, in May, and today he has no known cancer in his body. And he agreed to be interviewed by me several months ago, and we posted it, and if you saw his pictures from then and now, it would blow you away.
That's fascinating. So, do you think the ozone treatment targets specific cancers, or do you think it's generally effective? Is it, like some herbs are generally effective for cancer, like curcumin?
Of course, and it's going to vary from person to person. Please, viewer, don't think I'm telling you that ozone's going to cure everything out there. It's not. We just got particularly fortunate with Swami. He sent another Swami to me who has melanoma a few months after I first saw Swami A. We'll call him Swami B right now. Swami B with melanoma is still alive and well 4 years later with stage 4 melanoma that is slowly regressing. And he's getting these therapies. And they sent another Swami to me, Swami P, with lung cancer. And I thought he would die of heart disease long before his cancer because he came with end-stage heart disease, and he lived 3.5 to 4 years getting these therapies intermittently, and he didn't die of cancer. He died of heart disease. Of course, I have other people who didn't do so well. So it is very individual. And there's other therapies that are out there that have helped cancer patients. So oxidation, and incidentally, there are articles out there that ozone therapy is recommended now by many people as a potential treatment for cancer. Why? Because tumors are hypoxic. I'm sure your viewers are aware about, know this. So hypoxic means low oxygen. And the research is showing that the more oxygen, the more enrichment of oxygen you can get into the tumor, the better it's going to behave. And as we've talked about, ozone increases oxygenation of the body. So if you get more oxygen into the tumor, you're going to get a better behaved tumor aside from modulating your immune system.
Yeah, and in some protocols, I've interviewed some physicians who are aggressively using nutritional ketosis and hyperbaric oxygen, which I would imagine be somewhat similar. Go ahead.
Yes, hyperbaric oxygen is probably really valuable, but it's expensive, it's time consuming, and in my experience, I've done both. I had hyperbaric oxygen for years. I would take ozone any day over hyperbaric oxygen.
Wow, that's a pretty powerful testimony. Thanks for sharing that. How, in these advanced cases, I'm assuming the malignancies and cancers that you're using intravenous approach, not rectal, or both. What's the protocol?
With cancer, we're doing it both intravenous and we're doing a combination approach. intravenous, either ultraviolet and or ozone therapy. There was a monograph published 40, 50 years ago by a man named Olney, Olney, and you can find that online. Olney and cancer, Google it and you'll probably find it. He listed several patients with cancer that were cured using ultraviolet blood irradiation therapy and cleaning themselves up, detoxifying certain supplements. This was published 40 years ago. So we use one of these as a primary therapy. Then we also do something that I learned from my ozone training. We do what's called minor autohemotherapy. In that, you take a small amount of blood, about 5-6 cc's, and you shake it up with ozone rather vigorously, and then re-inject it almost like an auto vaccine. And I believe personally that stimulates the immune system. I got the idea around the time.
Do you inject it into the vein or into the muscle?
Muscle, IM injection.
Okay.
Or you could inject it in the vicinity of the tumor. There is a Swiss physician who was interviewed by Gary Null. I think his name is Bereyle or something similar, Beryl, who was talking about doing this minor autohemotherapy with prostate, where you take blood and you shake it up with ozone and then re-inject it around the prostate. And he said he was getting rather good results with prostate cancer. So when I saw that, I said, oh my God, what am I missing? I should be doing ozone minor autohemotherapy as well. And Swami was the first beneficiary of that. And since I've expanded it to also inject around prostates. And we've had some good results, not 100%, but some good results with prostate in that aspect. And then the third pillar.
How much blood are you using? Like 10 cc's?
5-6 cc's.
5-6, and do they get massive hematomas after you inject it, or?
No, they really don't.
Okay, interesting.
If it's a superficial injection, which we can do, then they might get a black and blue mark. But when you give it IM, there's no hematoma, nothing.
Interesting. Okay, so I interrupted you. The third question, or third point.
The third pillar of what I call triple oxidation is giving a small amount of gas intravenously, and people are going to go, oh, you're giving air in your vein. No, you're not. You're giving intravenous oxygen, and there are this therapy has been around in Europe for 60, 70, or 80 years. You can go online and type in intravenous oxygen. I think Reckelsberg, or a German similar to that name, pioneered this. And now Europeans are still using intravenous oxygen gas anywhere between, say, 20 to 50 cc's. And what that does is it seems to stimulate other aspects of the immune system, particularly an enzyme called 15-lipoxygenase 1. That's technical, 15-LOX-1. And then if you look at what that enzyme does, it has very strong anti-cancer properties. Well, I put two and two together. I was asked to defend somebody for intravenous hydrogen peroxide use, so I pulled down articles on intravenous oxygen, and I found that it stimulates 15-LOX-1, which is an immune modulator good for cancer, and it does a whole host of other things, such as improving circulation, blood flow properties, oxygenation, etc. Well studied, well done. It's dirt cheap to do, and I added that. And between the three, we seemed to get a reasonable hit on a fair number of patients that we were treating who had some serious problems.
Interesting. So when you use ozone intravenously, how does that work? I mean, do you just hook up the machine and insert a needle like you're giving it an IV?
The way we typically have done it is we take blood out of the vein, and I would say the amount of blood would be the amount that's in this cup.
Okay.
7 ounces.
Okay.
And then the blood is hanging up like here. We add ozone to it, stir it up, and then the blood goes back into the patient very quickly.
Okay.
That probably is what I would call the safest way to do it. The patient experiences no discomfort, No other problems. It's a little more expensive because you're using equipment. There are a number of people around the world, and when we go to Africa next week, we're going to be using the following method. We're going to be giving the gas directly intravenously. And again, this is not air. It's metabolically active. Oxygen is absorbed and it's burned very quickly.
Well, it's 99%. So, it's 99% oxygen, 1% ozone.
Exactly.
Okay.
And ozone is oxygen. So it's 100% oxygen, but 1% of the total is O3, not O2.
Right.
And O3 reacts in your blood immediately to stimulate a cascade of reactions creating something called ozonides, biochemical molecules that are highly metabolically active in the immune system and in circulation. Well, DIV, direct intravenous gas, pioneered by the fellow that I'm going to Sierra Leone with, and he's pioneered this therapy. I want to give him credit. His name is Howard Robbins, and he's in New York. He gives it by this method, direct intravenous gas, and it is extraordinarily effective as well. It's dirt cheap to do, especially in Africa, because you're only using a syringe, what's a syringe going to cost in Africa? 20 cents?
Sure.
And all you need an oxygen tank, and of course you need your ozone machinery. There's your price tag, is the ozone machinery. So that's how we're going to be doing it in Africa, where there's virtually no waste except a little butterfly needle that goes in the vein here. We're not taking any blood out, reducing contamination. Now,
how many cc's are you injecting?
Excellent question. You start slow with like 20 cc's, and he works up probably to a maximum of 120 cc's. Mm-hmm. Of gas, and he gradually increases the concentration. Now, there's two issues with this. Initially, in the early stages of this treatment, you can get a cough and some chest tightness, which you eventually, with further treatments, modulates and goes away, and it doesn't seem to be a big problem for you. And it's not a big problem initially anyway. It just can be a little uncomfortable because it takes about 5-10 minutes for it to go away. The other problem that concerns me a little bit more is if you do this repeatedly over and over again, it can do to the vein what intravenous hydrogen peroxide does. It can make it go away. I have not seen that with doing major autohemotherapy, actually taking the blood out, treating it with ozone, and putting it back in. We've seen no vein problems with that, other than, like I said, you're sticking the vein, which repeated trauma. But if you give ozone gas intravenously, yes, it's going to act like hydrogen peroxide.
Sure.
and can sclerose the vein. Now, in Africa, when you're dealing with something like Ebola, I'd rather sacrifice. I would be happy to sacrifice a couple veins for a dirt cheap, quick fix. In his office, he does it very well. He says he doesn't get a lot of vein problems. I'll be honest with you, there are some vein problems, but this is it's a wonderful way to do it. So that's another means of doing it. And I'm going to have to say I fully endorse it. And incidentally, I told you I'm doing it as well. We are giving the gas intravenously, not in high concentrations of ozone, and it seems to be adding to the effect of modulating the immune system.
Oh, fascinating. So a big important question for you. There's likely going to be, I suspect, curious what your views are on it, a major suppression of the results that you get if you do achieve the results you and I both anticipate. So how are you going to spread the information? Obviously, we can help support it, but you're going to publish this? Do you think? I mean, what's your best guess as to what's going to happen after you come back?
One of two things is going to happen. Let's assume we get the results that we expect, and I wouldn't risk my life. By the way, my family is against this. My immediate medical family is against it. They really don't want me to go, but they realize there's a calamity afoot, and if it reaches our shores, all of us are in huge trouble. My wonderful wife, Terry Sue, MD, is my rock. She's supporting me, and she's the person I have to answer to. What will happen, assuming we're successful? One of two things will happen because we are coming at the invitation of the government of Sierra Leone. You're going to have an actual government, sovereign government, come out and tell the world it appears that we have a treatment for Ebola. That will make international news, and international news very quickly. I fear you're right on another hand, though, because there are commercial interests afoot that stand to make billions, maybe trillions of dollars on Ebola work, whether or not what they do works or not. Through vaccines that we know don't work, to other treatments like the ZMapp or whatever it is that it is. I'm not paying any attention to that, to be honest with you, because it's probably going to be dangerous. And even if it's effective, it's going to cost so much. It's ridiculous. Suppose we can treat Ebola and cure it for $10 a person. Huh. That's pretty cool. And that's worth going and trying to do this. Will it be suppressed? Probably yes. And I'm not afraid to tell you that my bigger concern in this, because my friends have told me this, very concerned friends, that we will be in greater danger from that, from those interests, than we will be from the Ebola itself. And I'm looking at you right now in the eye, and I'm telling you that.
So recognizing that that's a serious threat, and you're in international territories, you're not under the jurisdiction of U.S. law, do you plan on having any personal security over there to address that threat?
We sure hope to have it, especially since the government itself is inviting us. But, you know, I got to do what I got to do, Joe. And this is my life, it's my career, it's my life's work. And it's the culmination, in a sense, of my life's work, even before I reach 80 years old. So it's something that I got to do, and we're all of us who are going, we're being guided by something much higher, and it's something that I have to do, no matter the risk, because the risk is far greater if we don't do it.
Well, I applaud your efforts, and I am excited to see this happen, and really look forward and anticipate the positive results that I believe you're going to achieve. And I also want to thank you personally for educating me about ozone. You have done for tens of years now, and I just finally woke up and realized why haven't I been doing this sooner? So, I'm embracing wholeheartedly. I would absolutely and strongly endorse and support your recommendation that everyone find a clinician who could administer these oxidative therapy, because they really are crucial. You need some type of weapon to fight these outrageous potential epidemics that might impair us, and even if not for those, for the common diseases like knee injuries and such, or knee replacements. So, the degenerative joint disease. I mean, there's so many things that's useful for, and I would strongly also encourage you to look at Dr. Rowen's channel on YouTube to see an example of what it can do for people, and so you can avail yourself to this relatively inexpensive and incredibly safe therapy with virtually no side effects.
Right.
Yeah, so you're a real asset and treasure to the medical profession, really what a physician should be doing, and doing it at great risk to yourself, not only health-wise, but certainly professionally. I mean, there's just like you or like me, there's loads of efforts to discredit what we're doing because we're a risk to their bottom line profits.
And there's another danger in this too. I can't sit here with my teeth in my mouth and promise you that this is going to cure Ebola at all. I mean, this is a virus we haven't seen. Now, I can usually get rid of herpes zoster in a couple days with ozone therapy. That's shingles. And we can cure a lot of these other acute conditions. But this is a pathogen unlike anything that we've ever seen before. I don't know what's going to happen when we do this. Maybe the patients are just so toxic that they're going to be overcome by anything we do. I don't know. So one of my fears, Dr. Mercola, honestly, is if it doesn't work, I don't want to see ozone discredited for all the other miracles it does.
Well, I appreciate your concern, but just looking at ZMapp, which only is passive antibodies, and really isn't a drug, as I said, passive antibodies, just slowing down the viral penetration to the cells. And if that's working, I mean, ozone is orders of magnitudes more effective than this, so how can it not work? You already have an indication through the use through people's lives being saved through ZMapp. So, I mean, to me, this is a no-brainer. There's no way it can't work. There's no way.
You are so spot on. Thank you for explaining that to your viewers. It's passive. That means that you have a virus here that would otherwise be active. The antibody comes and grabs it. It's passive, but there's only so many of these antibodies. The viruses are in your cells spilling out more and more and more and more, billions of them. So it's passive. It can buy you some time. Your immune system still has to catch on. If we flood the body with ozone, and we can give this ozone round the clock, we can give it 24/7. We're probably going to do it every 3 hours to let the body adjust to what it's doing, and it's non-toxic, at least in the general population it is. Yes, we're doing the same thing that the antibody is doing because the ozone inactivates the virus. And furthermore, since we're not giving a passive antibody, but we're neutralizing the virus, now you have viral particles that are still antigenic, not infectious, but antigenic, that can stimulate your immune system, that it itself will make the antibodies. Did I make that clear?
Absolutely. That is an authentic vaccine, the way it's supposed to be done. Not the crazy, ridiculous, insane, irrational approaches being traditionally used in most all vaccinations. So that's the way to do it. So I'm just so excited and really eagerly anticipating your results. So, all right. This is terrific. I thank you so much for everything you're doing and going to be doing, and for all of the information you're sharing, and really breaking ground on these innovative strategies that really have such a tremendous impact. And hopefully when you come back, we'll do another interview, and you can share your first-hand experiences there. Take a lot of pictures. We'll insert those. I'm sure people would love to see them.
We're hoping that the Sierra Leone government itself or the doctor there will arrange a documentary on this. Again, I wouldn't go and put myself at risk if I didn't think that what I'm taking there to use to help these people wouldn't take care of myself. So I'm really excited about it, and I'm really hopeful that this is going to change the world, that we will actually get, this is my prayer, really. I pray about this every day. It's my prayer that the results we get in Sierra Leone with this is going to change the disease maintenance paradigm of the world. I call it the sickness system. We need a paradigm shift.